And I cannot tell you how surprised I am. I really am. Like I kept hearing from people that they were really enjoying it, and even people that had tried a different one before, like semaglutide, which is great for a lot of people. But then they went and wanted to try tirzepatide, and I did this same thing, and I'm just really blown away. I'm so far about 7 pounds down, but what I'm noticing is I'm not as blue anymore. I don't know if I how we can't really make a whole lot of medical claims, but I'm not as blue anymore. And I was taking things for my blueness, and I'm not needing to take things for my blueness anymore. But the bigger thing for me right now is I am in menopause and I am not having a single hot flash. And I'm so thrilled and excited. I can't tell you how surprised that was, like a big shock. I had no idea that that was going to happen. So I am so excited. Dose day is Saturday, and if you know, you know, like you can't wait for dose day. So it's such a fun thing. So I'm loving it right now.
Well, and right before we get started, one of the things that I think is like our body keeps the score on everything. And so I think a lot of times when we put our mind on, we focus and put our focus and attention on something like side effects and, oh my gosh, should I be doing this? And hiding in the closet, giving yourself a weight loss injection. But when you open up to saying, wow, I am so grateful that I'm able to invest in myself and my health, and my body is miraculously healing. Thank you, thank you, thank you. Like I do, it made such a big difference. And just kind of learning to listen to your body again and what it needs, and kind of falling back in love with the whole process of, because of many of us, when we start on the GLP-1 or some of the peptides, we're feeling broken. So I'm going to kick it off where Hanieh's hopping on in just a few minutes. When I see her, I'll let you know we are packed tonight, which I love. I want to introduce, hi, Vanessa. I want to introduce myself if I haven't met you. My name is Beth Graves, and I have been in love with peptides and optimizing my health. I took a serious look at what was happening to my health 2 years ago. And I'm all about, I want to live a life that looks as good on the outside as I feel on the inside. So I was kind of living a life where it looked good on the outside, but on the inside, I wasn't feeling so hot. My health was failing, and a lot of it was just not understanding how I could optimize my health through the use of peptides. And my other love is building community around what we love, and sharing and helping other women and men along the way. So when I was able to, which I didn't even know it existed, I remember saying to Blair, you know what? If there's ever a company that has the network marketing model, which means we can build teams and we can share and make affiliate commission and then build community around what we're passionate about, I am there. And literally, I think it was 4 weeks later, when I got brave enough to post about GLP-1, and that is the tirzepatide and semaglutide, which are the weight loss injections, I was hiding it. I wasn't telling people about my journey. And I decided, you know what? I'm going to step up and be brave, because I want people to ask me. And I didn't even have an affiliate link at the time. And that's how I got connected to Hanieh Sigari, who had just founded June 1st, Ellie MD, a telehealth platform that is dedicated to optimizing our health and longevity through the use of peptides, which you will hear about tonight. The big one right now that we're talking about, that it's all over the place, are the weight loss injections, the tirzepatide, the semaglutide, the brand names out there. We go through a compounded pharmacy. Hanieh will explain how that works. But my story began 2 years ago when I snuck into a vitamin B12 store in the mall and got like some like, I don't know what it was, but they said it was semaglutide. And I literally had on sunglasses and a trench coat. Did anybody like sneak around when they first started with their semaglutide? I'm not telling anyone, because I should be motivated to do this on my own, right? And I snuck in. I didn't even tell Allison, who's on here tonight, who had helped me with functional medicine. I literally snuck into the B12 store and I was like, well, this stuff doesn't work. I'm not feeling any different. And then I decided to go through a very, very reputable compounding pharmacy to learn and do it the right way, and still was feeling like I needed to hide this. But what happened was my body started to respond. And I was like, wait a minute, I'm not broken. My blood levels, I had my blood sugar was regulated. As I'm losing weight, you know, every pound is 6 pounds off your knees and 4 pounds off your hips. So 60 pounds later, I'm like moving around the tennis court. I tell people I'm like a 40-year-old again. I'm going to be 59 next month. And these peptides, and what we're talking about here has truly allowed me to optimize my health. And then when I learned about this opportunity to be able to create a community around sharing this knowledge, like we're a bunch, like Vanessa's on here tonight. I'll be like, tell me more about that peptide, and we'll share videos. Today I was learning all about synapsin. And really what it comes down to is, how do we optimize our health for longevity, and how do we do it in a way that's safe, that is going to give us long-term benefit for all of the effort that we're putting in, and the build and stack habits upon habits. With the GLP-1, my story is that I believe in my subconscious mind, I just thought, well, our family, when we hit 50, we just start gaining weight. Like that's just what we do, but we're healthy German stock. So that's okay. I'm big boned. And I told myself over and over that I was going to gain weight, that this is just the way it is. And when the tirzepatide started working, it was like building a new neural pathway. So I don't know if you guys, any of you have any beliefs about what your body's capable of doing, because you feel that the diet roller coaster, the diet industry, the Jenny Craig, the Weight Watchers, the keto has failed you for so long. And suddenly you're like, nothing's going to work. This I have heard from so many people, and so many people that are on here tonight, that it's like, I am not broken. I have just done a ton of repair with these peptides. And I don't speak from a science place. Allison, if we were in biology together, she would have been helping me through biology class. And as we wait for Hanieh to hop on tonight, which she is going to be on.
I'm here.
Oh, you're here. Okay, cool. So there she is. We have so many people, I can't even find your face, which I love. So this woman right here that you are about to, like, I will tell you, she'll wrap you in a love burrito. That's my latest thing, but she is brilliant. She'll tell you about her background, but the thing I love the most is she is a beautiful mom to her 2 boys. She has a passion for bringing this health part of our lives, like optimizing the peptides and getting away from fixing the disease after it happens, and focusing on how do we help promote health. And the way that she wanted to do it was to get all of us as the soldiers on the ground sharing, and she would create a beautiful platform with her partnerships with the doctors, with the compounding pharmacies, with the brilliant practitioners that help us along the way. And I'm going to have her explain this business model. All I know is that I am so excited that she popped up the day that I decided to come out of the closet about my GLP-1 journey, because all of a sudden I was like, oh, we're out. We get to talk about what's truly helping us back to better health. So I'm going to turn it over to our founder and CEO, Hanieh Sigari, to share her story and wrap you all in her love burrito. So here we go.
Beth, I get so emotional every time you share that. And thank you for the beautiful introduction. And thank you all for joining us this evening. I really appreciate that you're here to hear what we're trying to do at EllieMD. It's a very special community that we've built so far. And I believe wholeheartedly, big movements, start with small communities and small groups of people. And here we are, trying to shift healthcare from sick care which is where I've always been. I've been in the world of healthcare and sick care for a majority of my adult life, and I started in the world of nursing homes in my teenage years. So this has always been my world, and now we're trying to shift it from that sort of sick patient care to preventative medicine using innovative medicines that are available that were once only available to select few, the people that really wanted to research and find out about peptides and biohacking. Well, now we're trying to make it accessible and available to the masses. And I think it should be available to the masses. I think your healthcare should be something that you can have control over and to know what's happening on a cellular level. So I'm just so excited through EllieMD. We're able to bring this to all of you on a mass scale. And I'm sorry, I lost my voice. I have two little ones, as Beth said, and they're always sick. School started. So they gave me something that I'm fighting off. Luckily, I have a strong body, but so if I sound a little off, I apologize. Um, should I share my story? I don't know. I feel like I repeat it. And I love telling where it all started, this passion for longevity. Okay, Blair is shaking her head. Yes. So when I first came to America, my parents moved us into this 65 plus community. It was actually 85 plus. And these grannies, talk about wrapping you up in love. These grannies just wrapped me up in their love, and they gave me so much. And I would go to Miss Madeline's for my homework, and I would go here for my spelling test, and I would go to Mr. Richards to teach me about the arts and jewelry making. And it was just incredible, just this beautiful, beautiful community. That's, I think, where I learned about the power of community. And we were all together in just a big group, and we would watch our PBS shows together. And it was lovely until I hit 5th, 6th grade, and my friends started to pass away one by one. And I was attending more funerals than birthday parties. So it was this really tragic, depressive phase in my life for a little girl to experience so much grief. I was like, I'm going to do something about this. And I would tell my mom, I'm like, Mom, what is this fountain of youth that they talk about? And so I set my mission and my goal on helping people live longer, healthier lives. And I lost my grandparents at a very early age. So to me, this aging process, it was this inevitable thing that happens. But the more research I've done throughout the years, I realize aging is a disease that can be slowed down and even reversed. Science has proven that. And that's what we want to do here. So I started working in nursing homes, and then from nursing homes, I worked there all throughout my college years. I chose to go to an in-state university. I got accepted to out-of-state colleges at Penn State and UConn, and I decided to go to Rutgers just so I could service my grannies. They relied on me. They depended on me. So I would do my back-to-back shifts at the nursing home on the weekends just to make sure I go back and forth. And I learned a lot. I learned about the joy of life and so many wonderful things. So after I graduated college, I decided to go to grad school and study biochemistry. And after that, and a lot of that had to do with understanding the body. So my undergrad was in biology and psychology. So I thought I had this interesting understanding of the mind-body connection, but I knew I needed to go even deeper if I really wanted to understand it all. So I studied biochemistry, and then after that, I continued my education in gerontology. I started a program, and we actually launched the Elder Life program, which was a Yale University beta program launched at the U of M health system. So that was wonderful. And I was like, okay, now I have this basis, this educational basis, research, and some programs and protocols that we launched and hospitalized them. And how do I take this and really apply it to the masses, apply it? So I decided to start a home healthcare company. And my goal was to help maintain baseline in Alzheimer's and dementia patients. And of course, when you really love what you do and you're passionate about it, it grows and grows, and it grew bigger than exactly what I wanted to do. So after a couple years of doing that, 4 or 5 years, it felt like my approach was, number one, it was very much based on end life and helping people in the end stages. And I was like, well, if aging is something that can be prevented or slowed down, why don't we start earlier in life? Why are we waiting until, it's already the disease stage has happened? So, and also I wanted to have a more localized impact that I was having to a global impact, right? So I took a little bit of time off and I hit the drawing board and I put together all the recipes and everything, my wish list, as I would call it, everything that would make the company amazing and great. And one part of that recipe was the people involved, right? If you have individuals that are just as passionate and there is a monetary incentive, they'll share your message. And also education is a big part of what we do here at Ellie. So I thought maybe if I could educate her, she'll go spread it in her community. And of course, we have gentlemen too as part of our company. So I launched the very first telehealth company in the network marketing space and ran that for several years. I was a little scared to start with like this mission of longevity. I was afraid that people wouldn't quite connect to it, understand it, especially in network marketing, where innovation was lacking for a very, very long time. There was a lot of supplement companies, and I was like, well, how can I explain what I'm trying to do that has never been done before? So I started with personalized skincare, and I'll share with you guys why that'll be relevant. So personalized skincare, we're talking about everything made just for you, right down to the name of the bottle. Launched with that, and then slowly incorporated prescription grade skincare products matched with a doctor. It was a telederm service, unlimited access to your doctor for an entire year, your dermatologist. And then from there, we were planning on going into hair care and then weight management. And for me, this concept of longevity was very much like, it bothered me. It was like this knock on a door, like that's what you have to get back to. That's what you have to, don't forget what you're here to do. So we launched the weight management, and it was this big lever when it comes to longevity. Obviously, weight is a big part. And then I had the opportunity of starting over with Ellie MD. So when that opportunity came, I was like, all right, we're going to do it all over again. And this time we're going to do it right. I'm not going to get pigeonholed in the world of skincare and beauty. I'm going to launch with a longevity brand. And it's going to be based off of everything that I'm passionate about, and especially in the world of longevity. So right now we have 5 verticals that we offer. It's sexual wellness. We offer longevity products. Longevity is the big umbrella, but we do have longevity products. We also have weight management products. We have diagnostics and hormone therapy also coming. And soon we'll also incorporate skincare and hair care, because that's all part of longevity. So when I think of longevity, it's just like, think of this big umbrella, everything that we can do to slow down or even reverse the process of aging within the body, right, on a chemical level. So I'm just really excited to be on this mission. We have some amazing products currently that we're offering, building out each one of these verticals individually, even more nutritional supplements and products, your protein shakes, and adding to the line of peptide products that we have, adding to the line of sexual wellness products that we have. So just really excited about where we have been, where we are, and where we're going in the near future. Diagnostics are right around the corner. These are the small levers that we can pull, right? With the weight management products, that's the big lever that we have. And I actually like to call the GLP-1 medications longevity products, not weight management products, because they have so many incredible impacts and they play such a critical role in a lot of different processes in your body, from neuroinflammation to heart disease to so many different things. I mean, the articles are coming out, the research is coming out. So it's the one big longevity product that we have. And then with our other products, we can fine tune the levers. But the goal is not to stay in the world of pharmaceutical products and just give you it's to give you the tools, everything that you need to stop the aging process, slow it down, reverse it, potentially help heal your body, as Beth was saying. So I'm looking for my soldiers on the ground to march forward with with this brand and the education that we're bringing and what we're bringing to all of you guys. So thank you for the opportunity and allowing me to share my story, my vision, and where we want to go in the very near future. Thank you all for being here. Thank you.
Thank you. Okay, I have a quick question for you.
Sure.
We're only on 7 Zooms a day together, so it's like I know the answer I want. So the people that are on here tonight that are trying to figure this out, can you explain the process of what I loved was I no longer have to like check in with somebody in the morning and make sure they're drinking their shake at the right time, that I'm pointing them into a telemedicine portal. So a lot of people have said, how does that work? Because this is backed by science and guided by doctors. Can you explain the process, and then what happens from from the time that I might say, Vanessa, oh my gosh, I need to tell you about NAD. I send her a couple of quick things that are right there. I mean, everything we need is already there, like the training for the teams, the product information. And she goes in, can you explain the process a customer takes and also the compounding pharmacy?
Sure, sure. So we've tried to make it as simple as possible. There are certain states in the US that require synchronous appointments, and that's a telehealth visit, either via phone call or a video visit, depending on the state. But for a majority of the states that we have, about 40, I think there's 41 states in the US that are asynchronous, which say that you don't have to have a telehealth visit. So let's talk about that process first. So for all those states, you take a short quiz. If you want to upgrade to a synchronous visit, which means a phone call, you can. However, if not, you just take this short quiz, depending on the product that you're interested in. And then from there, the questionnaire that you filled out gets sent to a doctor. If a doctor has additional questions, they'll either call you or text you. They'll send you a message. You'll be contacted. And from there, if there are no other issues, no contraindications, there's nothing that the doctor finds alarming, your prescription sent to a compounding pharmacy and from prescription by your door within typically 7 business days. I'll give you the average of it, right? There's times where it shows up within 3 days. There's times where it shows up 8, 9, 10 days. So let's just take the average and call it 7 days. It'll show up at your door. And that's really it. And if we're talking about the GLP-1 products, every 3 months, you're going to be able to take a reassessment. And during the reassessment, the goal of these prescriptions, especially GLP-1, is not to go up in dose. It's to find your sweet spot. So after 3 months, we asked you a set of questions, specific, how are you feeling? How much weight have you lost in the last couple of weeks? Are you satisfied? What are your symptoms? If you're feeling well, we'll set the schedule for your next patient, which is based off of you, your body, and where you are in your dosing schedule. And that's it. We can process. So for a 3-month dose that gets sent to your door. And part of the reason we do that, and it's a 3-month commitment, part of the reason that we do that is to make sure a lot of people don't lose their weight within the first month and they get very discouraged. And a lot of times you won't. There's a titration schedule for a reason. You have to slowly titrate up and you have to adjust your body incrementally. If you take too much, you're going to be so turned off, you're going to be nauseous, you're not going to want to continue. So we slowly titrate you up. And after 3 months is really when the magic starts to happen and the weight loss starts to take place and you start to find your sweet spot, as I like to say. So that's that with the GLP-1 medications. And then as far as the synchronous visits, if you go on, you can schedule an appointment time and a doctor calls you at that time. Typically it's within 30 minutes of you taking the questions. And then that's it. Same thing, same process, prescription sent to the pharmacy. But everyone currently has access to it.
Is it Hanieh's or my internet connection that's shaky? It's Hanieh's. Okay, so one of the things that I love is that I'm having a lot of conversations with Joey said, can you explain the products? If you go to the EllieMD website, Joey, every single product is there with everything about it, the testimonials. The most surprising product for me that I have had many customers is in the sexual health category, because they go over and they start looking at the big talk right now is the GLP-1, but we have so many other things happening. And so I love getting the testimonials from my postmenopausal friends that are like, it's heating up with my PT 141. So you guys will have to check that out. So what I want to do right now is a couple of quick shares of people that are going to share about their experience with some of the peptides or with the business. And I'm going to turn it over. So my friend Lindsay, we have been friends for a long time. And actually, she's one of the reasons why I knew I wanted to share the GLP-1 with other people, because she reached out to me well before this opportunity came about. And I just was like, let me pour into you because I'm loving this so much and I'm seeing the results. And we always talked back and forth. I think we did like 3 different programs together and we lost 10 pounds and gained 15. And then finally I was like, Lindsay, check this out. I didn't make a penny on my referral because it was before EllieMD, but can you share your experience with your GLP-1 and then why you said yes to EllieMD? Lindsay's a teacher. She is a dog lover. She travels all over the world. And she also is a business coach.
Yeah. Hi, guys. So, I mean, that's a lot of my story you just shared, Beth. But Beth introduced me to the entire idea of semaglutide, honestly, I think in like 2021. And I have always been a person afraid to give my own shots, didn't want to do that, all the things. So long story short, I talked to my physician last year and she was like, we'll go ahead and prescribe it for you. We'll see if your insurance will pay for it. And my insurance covered it, but it was going to be $1,800 out of pocket every month for shots. And I was like, okay, well, I'm not that desperate. Like I will try to keep doing the things that haven't been working for me. Because, teacher salary, I don't have that kind of money to pay for my healthcare every month. And then I had a friend who, before I found EllieMD, told me that I could get semaglutide at a med spa. So I did that. I started that in August last year and I've lost 30 pounds on it. It's the first time that I haven't been hungry. I haven't had the food noise, which I didn't realize wasn't a thing for everyone else. Like I thought everyone else was hungry all the time like I was, or hungry a lot of the time like I was, and just had more willpower than I did. And I didn't realize how much that really was affecting my confidence and my self-worth. Like I have always thought I was a really confident person, but didn't realize like that was one of the missing pieces. But anyway, then when Beth told me about EllieMD, I love the network marketing model, but I also love the fact that I can just do the shots at home. So I don't have to drive to the med spa every week. So that's saving me an hour round trip and it's cheaper. Even before, me being an affiliate, me being a promoter, it's still cheaper than what I was paying. So I'm like, okay, this is a win-win all around. Like I get to be a part of this amazing team. I get to continue with what has been working for me. And honestly, it's the only thing that I have tried that's really worked. I've done literally anything you can imagine. Keto. I ran a marathon last year and I was the heaviest I've ever been in my life. So it's like, it's not for lack of trying. It's just, there was some missing piece and this was the missing piece for me.
Thank you, Lindsay. And
yeah,
I would look forward to, her messages in Messenger, because I'd be like, give me an update. And it's like a solution. And that food noise is it takes up so much space in our brains. There's so many other things that we as women and a few good men on here should be talking about, instead of like how many calories, what's the next program. It's trusting our bodies, and our bodies it's getting a tune up. I feel like we're treating our bodies like we're Ferraris, which we are. And so thank you, Lindsay. And thank you for also saying yes to the business, because I've always said, when we find something super special, let's do it. And you were like, if you say it's special, and you met Hanieh and you met Jennifer and you're like, okay, I'm in. So thank you. Our next share now, I love LaToya. We're new friends. And she saw me like lifting light weights in my little home gym. And she sent me that like, hey sis, you need to get to the gym and lift heavier weights if you're going to make some progress here. Because I keep telling people when I turn 60 years old, I want to I want to look like a fitness competitor. I don't know, but LaToya might get me to compete, because I was like, what's possible? What else is possible? Now that I started on the Semorlin, which is another one of our products, I'm noticing this lean body mass, and it's so exciting. So I would love, LaToya comes from a whole different perspective as a medical practitioner and a fitness competitor. I'd love to have you share, LaToya.
Hi, thank you.
And I did renew my gym membership today so I can lift real weights.
Yeah. I am literally at the gym right now, but I was super excited to come and talk to you guys. I have been talking about semaglutide with my patients forever. I'm an infectious disease nurse practitioner, so I see the ramifications of weight gain and heart disease that affect, diabetes with ulcers and wounds and things like that. And I've seen what semaglutide, tirzepatide can do. So I'm always like, have you talked to your doctor about, semaglutide? And surprisingly, a lot of doctors have not. Anyways, I was super excited to join. I have prescribed it. I've tried to prescribe it for my patients, and there's definitely been a lack. So, like Lindsay, I have referred people to, spas and, even when they have insurance, just as an access to get the semaglutide. And it's such great success. I have, I do bodybuilding. I had never thought about it necessarily for me until I started listening to more calls. I have a friend who competed. She's a real tiny, she's bikini. So not a lot of muscle, she's tiny, and she used semaglutide for her prep. And she's like, that quieting of the hunger, she will never go through another competition without it. When you're competing and you're decreasing your calories, I mean, the hunger is crazy. You just want to eat everything. So it's just nice to be able to have that. And so I am super excited to get mine and start my own journey just so that not just from someone who has 60 pounds to lose, but, someone in shape can use this too and have great results. So I'm super excited about it. I've used and looked at Simwerlin. So I'm just really excited about this company, that all the longevity peptides, just to learn more and more how to use them in just our everyday health and, create longevity. So I'm super excited to be able to have an access to share with my patients and friends.
Thank you, LaToya. Thank you so much. And I am going to so I know that Vanessa, and I want to tell you what's going to happen next, is Jennifer, who I said, like, what's your official title? I call her the unicorn of all unicorns in the whole network marketing industry, because we're so lucky. She does consulting. She teaches us all about sales. She answers a zillion questions, but she knows this industry inside and out. She's going to close us out tonight with the business vision and share some of the logistics of how, I always think that behind a confetti thrower needs to be that person that's putting that confetti, and here the yellow goes here, the orange goes here, the pink goes here. And that is what she does, is she keeps things in order for us. I'm a bit of a confetti thrower. And Blair is the one that puts it in the right color of a bottle for me. And so, Vanessa, I know you have some guests on here tonight that you want to welcome and just say hi to. So you did a great job of just, I'm getting the word out. People need to know this. Vanessa is like our in-house. She has studied peptides and longevity for so long. And I just love that she gets to do this with her sister-in-law, Blair, and they're having so much fun together. So welcome your guests, and then we'll move over to Blair, then Jennifer, and we'll be off, you guys, in 15 minutes. Our call will end at 7:45.
Yay. Thank you. I wasn't expecting to say anything. But do you want me, should I call them out by name?
Just say hi.
Okay. Hi. But I'm so glad to be a part of this. I'm so glad that everyone that I invited popped on. I'm so glad that each and every one of you are here. The last month of this experience has been so rewarding, and just the relationships that I'm making and what I'm growing, like how I'm growing in this health journey. Just another level. I've been in it for 20 plus years, but I just listening tonight, I'm like, there's a little bit of piece of everyone's story in me. And I just encourage you to find that piece of your story and like start watering it and growing it, and building the relationships in this community is just going to be such a blessing to you. And this opportunity, I mean, I'm just so excited to be here. I don't know what else to say. So thank you so much.
This is your first time in the network marketing space. And so what has surprised you the most about that team feel?
I am really encouraged by it. Actually, there's just no, like, the competitiveness, like just the camaraderie of the women together. I can like text a question or post something like, hey, what about this? And just the encouragement. I'm really loving working side by side there. I know Gary's there and he's a powerhouse and I'm excited to be around him too, but just the camaraderie with women is so healing and just amazing for me. I'm really just I'm so blessed to be a part of this.
Well,
This is
we're so happy to have you here. I love to say backed by science, guided by doctors, empowered by joy. So a joyful moment for me was, I said to Blair, I said, I have found, you know, how passionate we are about GLP-1. And it was like, almost like leaving, well, it was like, I thought we were going to be separating in a business that we had grown together for 10 years. So imagine my surprise when she said, I really prayed about this and I'm ready to start again so I can really talk about all of the pieces that brought me back to my health and continue to bring me health as it relates to going into early menopause because of having an healing from ovarian cancer and her passion here. So I thought I was like going to be the Lone Ranger heading out in the world. And about 3 days later, she said, guess what? I'm going to come with you. And so it's always fun to go to have someone that comes with you to summer camp. So Blair, do you want to welcome your guests? And then will you introduce Jennifer?
Oh, I'd love to. I know Talia's on here. I'm so glad you're on here. Joey's on here. I'm not sure who else because there's so many different names on here. So if I invited you tonight and you're here, I'm so thankful you're here. And if somebody else invited you tonight and you're here, I'm still really thankful that you're here because if somebody had not shared this with me, I wouldn't be here today. So I am so thankful. And I'll just share with you guys really quick the products that EllieMD has. They're preventative health. They're about longevity, whether it's the sexual health, the weight management, or the longevity category. Like Hanieh said, they are all about longevity. And I can tell you this after going through ovarian cancer and the amount of money that you spend when you get sick, do not be shy about sharing these products. Do not be shy, first of all, about the price point. These price points are so good. Like I was paying double for NAD. I was paying double for my semaglutide, I'm pretty sure. And so it's incredible that we can get these products, but the fact that we can get these products into the hands of more people because of having this telehealth option and being able to have the items shipped to their house. And a lot of people are embarrassed or afraid or don't even know where to go to get these things. And we have the opportunity to share it with them. And the reason that I'm so passionate about it is because once I learned about what preventative health can do for you, it was shocking to me. And I don't want my kids to ever have to take care of me again, like they did when I was going through cancer. I want to be that grandma who's 89 years old, still picking up great grandchildren and having fun with them. And I don't want my kids to have to ever take care of me. I want to live a long and healthy life. I don't just want to live a long life. And same thing for my kids. You know, I had cancer. Both my parents have cancer. It runs in my family. I know Talia has been affected by her husband passing away from cancer, who's my cousin. Like, it runs in my family and it runs deep. And so learning preventative is really important. So I can tell you this, shout it from the rooftops, share with people these products, don't be shy, and be excited that you have something that can really help people. And they might not be ready right now. It might be a year from now, it might be 2 years from now. I'm pretty sure it was a year after Beth told me about GLP-1 that I finally talked to Allison on here and was like, okay, I think I need to know more about this. How will this help me? And I'll just tell you guys really quick, you know, I love NAD and I love glutathione. They have been life changers for me for reducing inflammation and for helping me helping me through menopause. But my GLP-1 got rid of 33 pounds and most of it was lower belly, which holds estrogen, which is dangerous for somebody like me, and reduced my cholesterol. And I can make a whole bunch of other claims, but I'm not going to because they're medical. But my blood work has never been better. And I get to look at it every 4 months and I can show the proof is in the pudding. Like Allison's going like this. She's my functional PA. She's amazing. Yeah, $1,000, Vanessa said somebody was quoted for NAD. That's what I was paying. So I get it. And it was worth every dime. I'm just going to say worth every dime. I'll sell as many handbags and shoes as I need to make sure I get these products every single month. I told my husband, like, sorry, those beautiful bags you bought me and shoes, but they are being sold so I can buy injections. And that is the truth. So I'm so excited to introduce you guys to Jennifer tonight, who's going to close us out, talking a little bit about this opportunity, but maybe a little bit about her story too, because she has a powerful story. I love the fact that not only is she guiding us in the field and helping us every single day here at Ellie MD on the corporate side, but that she has a true story as well. And she has so much heart and compassion for helping others and for making sure that we're all taken care of. And so I'm so thankful for that, Jennifer. And I'd love if you would share with us a little bit about your story and a little bit about how they can join this business.
Thank you. Thank you. And thank you for everyone being on this call. It's an investment of your time. And I hope you find at the end of this call, it's an investment worth the time spent here. It has been an amazing journey for me as well. I'm a cancer survivor, going on 2 years. NED is what, as they call it, no evidence of disease. And as Blair was saying about the labs, her labs have never been better. My labs are incredible. Through chemotherapy, I gained a platelet issue where my body fights its own immune system. And I go in every 24 days to get what's called IVIG infusions to force my bone marrow to make platelets. And last Thursday was my day to go in for that 24 days. And my platelets were normal. Just crazy. Now, I know part of that is because of the beautiful prayer that Beth and Blair shared with me. I know that because I know the power of prayer. But what I want to say is, yes, these drugs make a difference. We know that as you hold on to fat, fat is the carrier of disease, and I had 4 pregnancies. For every pregnancy, I'd gain 50, lose 40, gain 50, lose 40, gain 50, lose. I've got 4 babies. So I was over 40 pounds overweight before I even started the cancer treatment. And then all the steroids, I went up to 207. About 4 or 5 months ago, I started on the tirzepatide and I'm down to 176. And I know that's making a huge, huge difference. It certainly is on my joints. I remember, both Lindsay and LaToya talked about that food noise. And I too thought everyone had that and that willpower because, my friends would say, no food tastes as good as skinny feels. I mean, I have that as I'm trying to lose the baby fat and all of the things, they would say as they were able to lose the weight, no food tastes good as skinny feels. How many of you have heard that? And it made me feel bad because I'm thinking, I am constantly thinking about food and I didn't understand it was a disease. I'd have breakfast thinking about what am I going to do for lunch and dinner, so it's made a huge difference. I don't have the food noise anymore. I've been losing it slowly. Like I said, I started at 207 and I'm down to 176 and feeling really, really good. And not only are my labs great, but my body's fighting its own immune system has slowed down. So tomorrow we'll see where my platelets are, but I'm feeling good and I'm not bruised. And those are the signs that I am low on platelets. So let's talk about the business opportunity because there really is a great opportunity here. There are other programs out there, other telehealth companies that have affiliate models. It's interesting as we study these who are our competition and have affiliate programs to look at what they're really paying. Most of them pay just on the first order. You bring in a customer, they pay on the first order, and then that's it. They're like, thank you, and we'll take it from here and take all the rest of the money. That's not Hanieh's vision. It's not our vision here at EllieMD. We know that you are our partners. You're the boots on the ground. You're marketing for us. You're sharing this with your friends. You're sharing the before and after stories and all of the things. And so we really do treat you as a partner, and we pay you on every single order throughout the history of the order. The base pays 20%. If you come in and it's your own personal order, you actually do make that 20% on your own order in the form of commission. However, you grab a couple friends, bring 3 more people, you're at anywhere from now 25 to 30%. Bring more people in, you can go up to 40%. So our affiliate pay is far greater than any of the others out there. And we do not just stop at the first one. We pay on all of the residual orders that go through. So you don't start at zero every month. You've got all your customers that you brought in, and you know that they're going to hit their replenishment order, and then you're adding to that every month, and it compounds, and it's just incredible. This company has only been around EllieMD for 3 months, and we just paid last Thursday for August commissions, and I'm not going to make any income claims, but I will tell you factual. One of the director corporates, one of the leaders in the company, we paid over $35,000 for too, and it's 2 months in. And that is great. You know, see, there is, you know, if you build, that's the thing. You cannot just join and then think that it's all going to come to you without any work. There is work involved. But what I love is the program that Beth and Blair and some of these others that are on here, they're putting the pieces together. We have great tools in your back office. When you enroll, you get this back office, we onboard you, we welcome you, but then you get the additional support from this team here. It's amazing. And this team that is being built is exploding, is breaking records. Within a month, 2 of these individuals hit director, and that's one of our leader ranks. You're just in good hands. I'm going to tell you, you're in great hands. And if you want to build a team, there's level pay and there's generational pay. We don't have to get into all that. Just knowing that you can be paid up to 40% on your own personal order and those customers that you bring in is good enough. And if you want to know how to build residual income and a team, this team can guide you. I'm happy to guide you. Laura Waghorn, who is our training and development manager, she makes herself available and her calendar available to do personal one-on-one coaching. And yeah, it's just, I love this community that we're building, and that you guys are part of this community and this journey together. Thank you for everything that you're doing.
Oh my gosh, thank you. I was just texting with one of my friends who's on the call, and I said, today we had a leader call, and I said, feels so good to be seen and heard and validated and truly valued, and asked like what it's, instead of just saying this is the way it is, helping and guiding us and knowing that you're so open to feedback and also open to helping us grow with your decades of experience, and you also growing massive teams. I come to you and say, okay, guide me here, mentor me here, because I really feel so strongly about so many of us that have had experience in this industry have come here saying, we don't want to feel burned out. We don't want to feel that competitive edginess. We want to build a community. And in this season of my life, like I'm an empty nester now. Someone said, sorry, I'm blowing up your phone. I'm like, you're my kid now. I love like this role that I get to have. And it's filling me with so much joy. And I love also the part about helping people meet those financial goals and having that financial freedom to pay for the private lessons, to pay for the speech therapy, to put away for the college fund. I had on my vision board way back when I started in network marketing that my kids would not have student loans for college. And my daughter just announced that she's finally going back. She hopes Columbia. So I'm gonna be working very hard with EllieMD, because I didn't imagine that to be the tuition, but those are the gifts that we have with having a flexible business that is cloud-based, that we can build from anywhere. Mm-hmm. So I know I'm so grateful. And Hanieh, closing words before we end. Like, I feel like this is such a love burrito. I just can't let go of this hour of this 45 minutes together. So share what's come to you, and then we'll close it out. We'll have the recording for you to share. And I'll encourage you also, if somebody invited you to this call, to just reach back out, ask questions, dive into what resources are available. And listen, I think I started June 29th. I still am learning every single day. And this is such an easy business because we just point them in the direction of getting into the telemedicine portal. And then we're here to support you with your mindset, with your faith and your courage. And all of those other pieces where we've built it all for you. So honey, close us out, please. And I can't wait to see you a week from today. You will be here doing your calls at this table in person in Florida. We meet the
I know. Literally in 1 week, I'll be right there with you. And Jennifer, thank you for sharing your story. I am so happy for you. And my gosh, we call her mom in our company because she really is like a mom. She takes care of everyone. She's always just worried about all of us. And she talk about wrapping us in love, Jennifer, every single day. So thank you so much. You will not meet someone with integrity, values, just the love that Jennifer gives all of us. So thank you, thank you. And I'm so happy for you, your health. My gosh, she announced this to us a couple of days ago. She's like, I checked my platelets, everything's good. They don't need to give me an infusion. So I'm so happy for you. And for all of you who are here, thank you for being on this journey with us. We're only 3 months old. I mean, gosh, we've achieved so much in 3 short months. And then just mapping out the next 2 to 3 months. There's so much in store for all of you. Make sure you tune in to our educational series. This Thursday, we're going to have Leanne come. Leanne Dudson, I think that's her last name. Dudson, I'm sorry. And she's going to come and talk about nutrition and microdosing, GLP-1s, and exercise and hormonal balance. So make sure you tune in every Thursday to see who we have on. And I know Allison will be coming on very soon. And we just have these wonderful educators as part of our community. And sometimes we bring other people from the outside. Like, make sure you tune in because this is more than just offering products and services. It's about really empowering our community through education. As I like to say, if you come to our website, you learn something, you buy nothing, we've done our job. If you come to our calls, learn something, buy nothing, we've done our job. So that's how it starts. Big movements start with small communities. And I'm just so glad that this little movement of ours has started. And we're going to make a big splash and big wave and shift healthcare in so many different ways. I know we will. It's just the beginning. So thank you all so much for your time. Thank you, Beth, for organizing this. Blair, Jennifer, thanks for being on. We love you so much. So much.
Thank you guys for being on. And the chat literally has like, if you read the chat, we have so many people that are so knowledgeable and so willing to share to gain that information. So I am so grateful. And I will tell you guys, just be courageous with sharing your story. All of you are here because I took a deep breath and posted a before and after in my stories. And my dear friend Sarah Cole said, hey, did you know you can make some money sharing GLP-1? I had no idea that it was going to be this. I was just like, oh, that would be really cool. And the next thing you know, I'm being introduced to Jennifer and Hanieh, and off we grow. So we'll see you next Wednesday. If you're on and you're like, hey, I want to invite some friends, please do. We do this every Wednesday, Thursday night. Leanne, who is also a part of this community, Blair reached out in a brave way to someone with so much knowledge, and she said yes to the business. And now she's going to come on and educate all of us. So all of what you need is provided for you. We just need your energy and your passion and your willingness to connect the people that you know and love to what we offer. So we'll see you next Wednesday. Reach out, or we'll see you Thursday. That's going to be a great Zoom. Whether you are already a customer or never will be, you're invited because it will be so educational. All right. Have a great night, and we'll see you all soon. Thanks everyone for hopping on.
Right.